Hey, Ashley here, allthingsdentistry.com, and what we're going to be talking about today is bone graft on a model. And specifically with the bone graft, talking about the flap you're going to be elevating and the periosteal releasing incision that you're going to be needing to do after you place your trusty bone graft, which is pretend this piece of plasticine is bone graft. So just before we get started, if you have no other use for this chairside soft tissue Reline, it makes good gums. Okay, so say for example the blackened out tooth is extracted. It's been extracted for a while, and what you need to do is you want to place, the patient wants an implant, but there's insufficient alveolar ridge width to place an implant. So what do you need to do? You need to place some bone graft. I mean, there's a number of ways you can do that, and we're not going to get into the discussion today. So what you're going to do is you're going to make your full mucoperiosteal flap, and you can see the outline here. We're going to go from, there's so many different ways you can do this, so don't get on me for the flap design. We're going to be talking big picture here. So we're going to go from mesial of the central incisor, wide large base, distal line angle of the canine, large base. We're going to make these little nicks in the flap here. We're going to go beyond. If this is a mucogingival junction, we're going to go beyond. Here's the anterior nasal spine. So you make these little nicks, and this is going to help bring that flap, be able to bring that flap over your graft. Now, so what we're going to do is now we have it elevated here. Now I'm going to show you, say you place your plasticine or your bone graft underneath here, and you go to suture this back down. Now what you want to do, imagine this tooth is gone, you're going to want to suture this and have primary closure of the buccal flap to the palatal flap. Now it's just not going to happen with that. You can see that. Without, it goes all the way down. With the bone in, it's nowhere near. So the way to mitigate that, one way is to do a periosteal releasing incision. I'm not even sure there's any other way. So what we're going to do is you elevate your flap, and at the base of it, you're going to release this flap from the periosteum. The periosteum is like super tacky. It's like super glue of your flap. Now once you release it, you're going to take your blade and aim it towards the bone. So you're going to start seeing, now you see how it's splitting it? Now pretend that I'm releasing this from the periosteum. So don't go this way, because what will happen is you'll whip through the flap and then you're done. Made your life much more difficult. So, and don't be cheap. You need a good periosteal releasing incision. You'll spend a lot of time fiddling around. Okay. So there's your releasing incision, and I can't show it in the model. Of course it's thin there. Oh, it broke through, that's why. Disregard the breakage of the GC Reline. So that's the intent. You can see how now I've released it. Now what you're going to be able to do is to bring this whole guy over, so you can kind of see that there. You can see it's, disregard that again. So you can see the stretching here, stretching there, and now you're able to bring your flap all the way over. So again, the key things to allowing this, because I tried it and I haven't released enough and it just didn't work. Forgot to put these little nicks. I'll try to figure out the name of those little grooves in the flap, and that allows you to, and you can see it actually here when you see how it stretches. See how it allows it to just come down a little bit more apically. I mean, that is significant. So when you're doing your ridge augmentation or whatever, remember those two things. It will save you a lot of time. Cheers.